Hey everybody, I'm Shayne Baylis for Proaction Sports Injury Clinic. Today I wanted to interview one of our new chiropractors that is coming through. He's going to be practicing with us. He's just kind of getting in the groove of things, so I want to kind of get to know him better. Hopefully everyone else can get to know him better and just have a good feel for what he's about and kind of his background a little bit. And a topic that we might be talking about too is a little bit of a stretching thing, because I know it's going to be a controversial topic, but his name is Dr. Andrew Creppin. He's been a past competitive athlete. He's played hockey and soccer, but hockey is where I know him the best. He's played for the Alabama Huntsville Chargers in the NCAA's Division I, also played for the Ottawa GGs, so he is a home resident here in Ottawa. He's grown up here with his family, and I'll let Andrew kind of take away other stuff that he's done, but why don't you tell us a little bit about your family, Andrew?
Thanks, Shane. So, yeah, I was born and raised in the East End in Orleans. Grew up there my whole life, and then big homebody. Basically, didn't really leave the nest till, as Shane mentioned, I went and played in Alabama Huntsville for NCAA Division I in the States. My mom and dad both worked in the community. My mom was in the government. My dad is out in Perth right now, doing power sports dealership. And then my brother and sister is also a chiropractor. So that helped me kind of direct me down the path into the healthcare system, and especially into chiropractic. When I was younger, I played both soccer and hockey competitively. I was a Gloucester Hornets growing up till 16, playing at the top level. And then at 16, I had to make the hard decision for my future of which one to carry on, and I picked hockey. So with my hockey career, I played Junior A, and I grew up locally through the Gloucester Rangers organization and played 5 years of Junior A with the Gloucester Rangers. So I met a lot of good friends through there and grew up playing with a lot of my friends. And then obviously inside the organization, I met a lot of the volunteers and still stay in contact with them because they're very influential. Shane would know the people you meet in the hockey community tend to stick with you for life, and I'm grateful for that. And then after that, I went 1 year into Alabama Huntsville, and then it was a tough time. The team folded, then got reinstated, but it just left a sour taste, and it was just an uncertainty. So I came back and played my career at the University of Ottawa. My dad played at the University of Ottawa too for the CIS, so he bounced back between the University of Carleton and Ottawa U men's hockey team. That used to be allowed back in the day. Now, not so much. So I came back to my home roots and my home ties, and then I did 4 years at the University of Ottawa and got my bachelor's degree in human kinetics. And then I spent 4 years at the Canadian Memorial Chiropractic College to get my Doctorate of Chiropractic Degree.
Excellent. Yeah, I know you play in the same league as I did, in the NCAA. So there was a few teams that folded in that league because it was kind of a newer league. So those can be struggling when you're kind of, trying to, start a career and have an education, having to bounce back and forth. So uncertainty, I can definitely understand that. So why don't you tell me a little bit about how you got into the realm of chiropractic? Because I know both your parents aren't chiropractors, but you seem to have a curious family dedication to this type of profession.
Yeah, so ever since I was young, I always knew I wanted to get in the healthcare field. I just wasn't sure exactly where I would land in it. For a while, I thought maybe it was going to be physiotherapy, but then when I got introduced to chiropractic through my brother. He's practicing in Calgary. He's been out for 5 or 6 years now. And then my sister graduated the year before me as well. So they kind of introduced it to me about probably 10 years ago. It was mostly through sports injuries. I've had back injuries, shoulder injuries, you name it. So I was very traditional, going through the MD route and then getting my referral to a physiotherapist. But I've had nagging back injuries for a while. And my brother's just like, here, this is what I've been into. Go try chiropractor. And then I went to him, and it was just a few treatments later, I finally got better, and it was a nagging injury for years. And I got better within a few treatments. And I think it just goes a long way to being along the track of what we do at ProAction Healthcare. It's the right diagnosis for the right condition. So I think they took the time to figure out what was actually going wrong with me. And it's not saying that other healthcare professionals don't do it. It's just my interaction with them, and then weighing out the educational benefits from it too. Because chiropractic was 4 years. It's a little bit more in depth compared to the 2 years of physiotherapy. And our educational hours are on par with medical doctors. And that's why we get the doctorate title, because we do have to go through similar training as them. And I think it was just more the exposure through my brother and sister. And it created me with that passion, because I really got to see how it worked in an in-depth view before actually even joining the profession. I got to hear what the schooling was like through my brother, and he was out in practice before I even started. So I got a lot of insight to understand the workings of chiropractic and how beneficial it could be for patients, and hearing a lot of success stories. So it kind of, I've always liked helping people. So it kind of directed me down that path, and I thought this was the best option for me.
Excellent. Yeah, so it sounds like, sports, obviously all of us sports people kind of thing, we like to deal with some of our, friends and colleagues in the area. So, active sports is something that we always like to do, treatment of those kind of conditions, just from just the camaraderie of playing with them, as well as, the interest on how this stuff occurs and how we can help other people in these types of fields and areas of sport, as well as active people like, the weekend warrior, or just people that are trying to stay fit on their own. That's excellent. So I just wanted to talk a little bit about what kind of practice you were looking for when you kind of got out, and how you gravitated towards a certain one.
Yeah, I went and shadowed a few practices. As Shayne would tell you, there's a lot of different ways chiropractors can treat. It's not a profession where it's just one size fits all, or one shoe fits everyone. It's very much on a spectrum. And I shadowed a few different ones. Some were just adjustment clinics. Other ones were more of modalities. And then Shayne's a unique hybrid, where it's more of
Unique.
very unique. Yes. Where it's just a lot of hands-on education and adjustment, soft tissue therapy. Basically, he has a lot of tools under his tool belt that he can use to help you, and that's kind of what I gravitate towards, is that there's not going to be one perfect solution for a certain condition. It's very patient specific, and he took the time to get into it with his patients and figure out what's actually going on and wrong. And one of the main things that really popped out to me is that at every visit is that you're always testing and retesting to make sure that our treatment's on track and we're doing the right thing to get the patient better. A lot of places I find it's just more of you're in, you're out. They take it as, oh, hey, how's it going? Oh, you're good. Come in here. I'm just going to go through the motions and do what I think's best and go, okay, go out. And we don't really know if what we're doing is actually helping them. So that's what I find made a huge difference, is that I found a lot of practitioners are missing that key aspect of it, is that we want you to get better. And Shayne really takes the time to let them understand that that's the end goal of this. And hopefully by the end of it, we can give you the tools to be able to keep yourself on the right track. And obviously, if you need us, we'll always be there for you.
Excellent. Yeah, I think we do take a big pride of just doing a retest after we treat something, see if it is improved, because we want to make sure that we're going on the right things, right? The whole point is to increase function. And if people can't increase function afterwards, or if they're going back to the baseline that they came in with, and they just feel better when they leave, to me, we're not going to the place where we want to go from a functional point of view and decrease some of those pain and discomforts that people are having. Even though they might get a little bit of a regression, but when they come back, we expect them to be improved and withholding some of the treatment progression that we've had going forward. So we're always looking to improve what we can do. And I think that's why we have the young guys coming in like Andrew, who gives a different perspective, right? He's been exposed to some of the newest technology or techniques that are going through there, and going, does it make sense for us to incorporate this into our treatments structure? And there's something that we're missing, that we may be overlooking as we all do. We get into our professions, and sometimes we stay in the same type of niche or box, that we do the same things over and over again without exploring some of the other options that might be coming into the world of technology nowadays. So that's great. You really touched on that part as well. Just learning a little bit more about you. And I hope if you have anything else to add, let us know. But we're really happy to have you on board. And I can just see that you're interested in learning and networking with people and helping people get better the best that we can and best that you can. Anyways, anything else you wanted to add?
No, that's good. Thank you, Shayne, and thanks for having me and getting me into these groups.
All right, guys. Remember, Proactive Sports Injury Clinic. We're at 308 Palladium Drive, just off Terry Fox and Palladium there. And, we'd be happy to see you. You can reach us at 613-505-5000. And hopefully we'll either see you soon or we'll answer questions that you have about this topic or any other topics you'd like to hear about. Have a great one, guys, and take care. Signing off.